As we age, our tissues lose its collagen and become soft and hanging. The other thing that happens is that we actually lose fat on our face. So the face becomes very empty. So where do they become empty? On top, forehead, temple become empty. We get a deep tear trough. We get very flat cheeks. And then the nasolabial line also become deep. The red Indian line also will show, and so that everything sags. What we can do is we can pump back things that has been lost. So we can use fillers. We can also use fat. It's natural. It's your own body's product, but it has to be harvested. It cannot just be injected. So we have to do a small liposuction to remove the fat. We have to spin the fat, concentrate the fat so that the fat becomes highly concentrated with fat cells, and then we have to inject this fat like a filler onto the face. We can inject on the temple, the forehead, the tear trough, the nasolabial line, and the cheeks. So this is where we inject fat to the face.